Hello everyone, welcome to my YouTube channel Medical School. So today we are going to learn about the spina bifida. So what is spina bifida? It's a birth defect. Occurs in the intrauterine period, mainly in the first month of intrauterine life. The cause for the development of spina bifida is there is a defect in the development of the spine, that is due to the incomplete closure of the two elements of our spine, that is the body element, which includes the bony spine, that is the posterior lamina, and the membranes around the spinal cord, which includes your dura mater and arachnoid mater. So there is a bony spinous defect and membranous defect. So we can see they be having the swelling over the lower back. So we can see in this picture there is a defect in the posterior element through which the swelling was protruding. So next there are the three types of the spina bifida. So first is the spina bifida occulta. Spina bifida occult. The second type is meningocele. Second is a meningocele. And third type is myelomeningocele. So there are three types: spina bifida occulta, meningocele, and myelomeningocele. So we will describe each type in the detail. So let's see the first type, that is spina bifida occulta. What happens in spina bifida occulta? Actually this is a mild form. So in this form we can see there is a defect in the only posterior element, that is the spinous process or lamina. So externally there is no deformity. In some patient we find the tuft of hair in the lower back on the lumbar spine. There is no visible deformity other than that. So this spina bifida occulta rarely associated with any deficit in the child, and this occurred due to the defective closure in the fusion of the two lamina and spine, which is also called as the split vertebra. So it's a mild form. So in this form of spina bifida, rarely any patient needs any further treatment. So you can see it's a mild form, and only outer part of vertebra which is not closed, and there is no protrusion of cord, and externally only tuft of hair cells seen on the back. These are the features of the spina bifida occulta. So we have already told this is asymptomatic in most of the cases. So now we will see the second type, that is the meningocele. So what happened in the meningocele? We can see in the picture there is a cystic swelling on the back, but the cord is not protruding, so only cystic swelling due to the defect in the posterior element. This is also known as meningeal cyst. It is known as meningeal cyst. It is the least common type of spina bifida. Mostly patient presented with the cystic swelling over the back, which is translucent. Through this cystic swelling, there is a herniation of the meninges without herniation of any nerves or the spinal cord, and it's mostly asymptomatic. In some cases, patient may develop tethering of the cord, that is the nerve which are traversing through the canal may stuck any of the surrounding structure, which is called as the tethered cord. So this is the second type. Now we will see the third type. This meningocele mainly located on the lumbar region, or in some cases it may be located in the cervical region, which is present as a occipital myelocele. So most common location is the lumbar spine, and another is the cervical or thoracic spine. So understood the two types. Now we will see a third type, which is called as myelomeningocele. This is treated surgically. We can excise this cystic swelling and close the defect primarily. Now we will move to the third type, that is meningomyelocele. It's a most severe form of the congenital anomaly of the spine. Why it's more severe? Because the cyst is not simple as that of the meningocele. This cyst contains your meninges, protruded nerve roots. We can see the nerve root protruding in the cyst. Also, in some cases, meninges along with the cord also get herniated into the sac. This sac may rupture and your nerve and spinal cord may get exposed, or due to the continuous CSF leak, patient may develop herniation syndrome, or a CSF get infected and patient develop the meningitis. This developmental defect occurs in the third week of your intrauterine life, the stage where your neurulation occurs. So when there is a failure of fusion of posterior elements of the spine, this defect occurs. Now we will see the I will show you the X-ray. This is the anterior posterior X-ray of the patient with spina bifida. We can see the bony defect in the spine, This is the lateral view. We can see the absence of posterior element and through with the spine membrane, spinal meninges, and some nerves are protrusion. So we will see the sign and symptom of spina bifida. So most of the patient present with the leg weakness. Now we can understand if the nerves are protruding or spinal cord or meninges are protruding, the patient may get the lower limb paralysis or weakness. Other patient present with bowel and bladder incontinence. The patients have incontinence in the form of dribbling of urine, wetting of the clothes. So they will have either sensory loss in the bladder, so they will not able to understand the sense of urination, or there maybe have a motor weakness, so they will not able to urinate. So both form of deficit may be presented in the child with spina bifida. It may be also associated with other anomalies in the body, like your Arnold Chiari malformation type 2, where there is a herniation of the cerebellar tonsil. These patients also present with the physical deformity like club foot, or these patients may develop hydrocephalus. So the patient in which there is hydrocephalus, we need to treat hydrocephalus prior to treating the cyst, because if we not treat the hydrocephalus, there is a sustained rise in the pressure and your surgery may fail, and there is a continuous leakage of CSF through your wound at the surgical site. Another anomaly found in the spina bifida is corpus callosum anomaly. There may be absence or there is a hypo development in the corpus callosum. The patient have mental retardation. Then we will see the causes of the spina bifida. So what are the causes for the spina bifida? First cause is the genetic cause. Another is the environmental cause. So which are the genetic causes? Patient with genetic causes have a chances that they may develop spina bifida in their second child, who have all child already born with spina bifida, or meningocele in the form of meningocele, meningomyelocele. It may be present up to the 4% patient with previous child with meningomyelocele. And what are the environmental factors? Environmental factors include the deficiency of folic acid in the pregnant mother in the first trimester. Another cause is the viral infection like variola, varicella, chickenpox in the mother. So these are the two causes, genetic and environmental factor. This is the reason why we give the folic and iron supplement in the mother during their first trimester after they diagnosed to have pregnancy. Then we will discuss the pathology, how it develops. The primary factor for development of spina bifida is failure to fuse the spinal element that is the spinous process, and lamina during the development, that is in the first trimester, mostly in the third week of intrauterine life. Another cause is trisomy. A patient with trisomy 18 likely to develop spina bifida in their child. Another factor is previous child with spina bifida. So prevention, how we can prevent the spina bifida? First is the dietary supplement of folic acid. As we already discussed, the mother with diagnosed pregnancy, there should be a all should be given a folic acid supplement during their first trimester and throughout the pregnancy. So another way of prevention is by diagnostic in the intrauterine life. How we diagnose with? By ultrasound in the second trimester. So by doing the screening, we can diagnose it in the intrauterine life itself. So if child have severe form of spina bifida in the form of meningomyelocele, we can underwent medical termination of pregnancy and prevent the severe deformity in the child. So there are various ways of doing screening. It may be ultrasound, fetal anomaly scan done in the second trimester, or we can do it with the other test like alpha fetoprotein level in the maternal serum. In patient with spina bifida, the level of alpha fetoprotein increases in the serum of the mother. Another method is by amniocentesis. In amniocentesis, we check the level of alpha fetoprotein and acetylcholine esterase in the amniotic fluid of the mother. I'm pausing in between because you should able to write all these notes. So you can write answers in the exam if you get the question on spina bifida. So right. Then another method of preventing why is genetic counseling. What is genetic counseling? If we have a patient who is already having history, genetic history of spina bifida in his family, like in a patient with trisomy 18, so we advise them to not to continue the pregnancy. Will counsel regarding the severe form of deformity in the child, and will counsel mother for getting genetic counseling to rule out trisomy 18, or if patient is diagnosed that her child is having spina bifida during the ultrasound scan, so we advise mother to go for medical termination of pregnancy. So